Can you go ahead and start admitting?
Hello, good evening, everyone. We're so glad that you can make it on this evening for our 2021 highlights and 2022 forecast. While we are still just waiting for a few seconds for everyone else to log in, I'd just love to ask if you could please introduce yourselves in the chat box. Thank you. All right, well, as everyone continues to put their names in the chat, once again, I just want to welcome each and every one of you. My name is Sylvette Latouche Howard, and I'm one of the honored health planners for the Prince George's County Health Department. Happy to be with you all today. And I am going to pass the virtual mic this evening to Dr. Stacy Little, one of our co-chairs for this wonderful coalition. Dr. Little.
I have to remember to mute myself in two places. Thank you so much for the introduction and welcome everyone. I want to just reiterate that we'd like for you to introduce yourself in the chat box with your name and affiliation. That would be wonderful. We also want to thank you all so much. We know that it is challenge sometimes to do meetings after work, but we so very much appreciate you and your efforts on the coalition, and we just look forward tonight to celebrate the achievements of all of us and all of you, and want to share our vision for the future. So we'll be focusing on those kind of categories, but specifically we'll get an update on COVID. We'll look at some, accomplishments and things that we feel very, very proud of as a coalition that were accomplished in 2021. And then we'll move on to the forecast for 22, and Dr. Carter will provide the vision for the coalition moving forward. So we're very, very excited about that. Before we move any further, I want to recognize any first-time attendees. Any first-time attendees, if you can just put your note in the chat box that you're here for the first time, that will be awesome. Thanks so much. And without further ado, and it's already welcome, Michelle Preston. We already have the slide up. We want to make sure that we give our flowers to the folks who have worked so hard in this coalition while they're with us. And so we're giving flowers today virtually or, figuratively, I should say, to Allison Mendoza Walters. She has just been an awesome contributor to the coalition over the years, and we cannot say enough about Allison. She really served the coalition well for 2.5 years and really guided and navigated the coalition and helping the coalition engage new members and grow the coalition. Also getting input into the work groups. Look at her there with her babies. And fostering collaboration within the coalition, and just helping us as a community to work together more cohesively so that we can begin to think through how we improve our environment, how we improve the health and wellness of the residents of our county, and that it becomes more seamless and it becomes less of a arduous task of how do we make change, because when we are together as the collective, we can move that rock that is the boulder becomes a pebble, right? Well, when you're by yourself, that boulder feels like that pebble, the boulder can feel overwhelming. But when you have someone and the collective of people together who are helping, it really can make a difference. And so we're so excited that that Allison was a part of that. And she, I have to also indicate that she helped us with the newsletter, the websites, and communication. And one of the gifts Allison gave to us is also, so before I move on to that, but I want to just, if we can do a virtual round of applause and thanks, and I don't know if there's ways that we could throw up different reactions to show our love and appreciation for Allison, please do, because we truly appreciate her. Thank you all. Allison, did you want to say a few words?
Just thank you so much. And it's been lovely working with everybody. Please stay in touch. I'm still working in the region. I'm still doing COVID outreach, still doing community work. So would love to continue some of those partnerships that we were able to form. And I hope we can just whatever organizations we're in, hope we can just coalesce together for this county, for this region. Thank you so much. It was wonderful working with everybody.
Thank you. Thank you so much, Allison. And one of the other gifts that Allison gave to us as a coalition, our babies are so beautiful, was an amazing RA. And we want to recognize her this evening, Naya Ferguson. So she is, and she has really been such a wonderful gift to the health department. She's a second-year graduate student at the University of Maryland, College Park, and she is in fact pursuing her master's in public health with a concentration in behavioral and community health. And she has been assisting the work of the coalition for about a year now as a technical assistance team member under the Office of Population Health, and has assisted with the diabetes-related and community engagement strategies, as well as social media initiatives. And of course, Naya is a resident of Prince George's County, so she's a Prince Georgian and has all kinds of Prince Georgian pride, and is excited to officially join the coalition and collaborate with the HEAL work group. So please do welcome Naya virtually. We so appreciate you, and we hope that you will continue all of your efforts with us while you're with us, and then who knows what happens after you graduate, but I'm sure you'll be a force regardless. I'm going to now hand over the slide presentation to Donna, who will be providing a COVID update.
Hi, good evening, everyone. So good to see your faces. And I wish we could be in person tonight, but it was not to be. For those of you all that may not know me, or if you're new to the group, I'm an epidemiologist with the Prince George's County Health Department, but I also have the honor to have the coalition in my Office of Assessment and Planning. So I wear a few different hats at the Prince George's County Health Department. So I always love to be on these calls to see what a wonderful job our team is doing and all the work being done with the coalition. But unfortunately, for the last almost 2 years, I'm the voice that tells you what's happening with COVID, so not as fun. But here, let's talk about what we've seen. Like, we're almost 2 years through COVID, which is so hard to believe. So I did a quick review. You can go on to the next slide. Did a quick review. I wanted to take a look back and say, okay, the news makes me anxious about COVID. I don't know about anybody else, but it seems to die down, and then it rears back up, and then it dies back down, and then it rears back up. And I was like, well, what can I tell you all about where we've been, where we are now? So just looking over time, at the very start of the pandemic, we had a percent of positive tests for county residents that was over 40%. Because we didn't have enough testing. We had, very little testing. So everyone who was getting tested was positive. So throughout 2020, we saw those tests increase. And what we've seen since then, when we had our kind of holiday winter surge, so to speak, our highest percent of positive tests at that point was 11.7. You can see what happened over the summer when Delta was introduced. Thankfully, we didn't get above 6.2%. So, all things considered, Delta was rough, but it could have been worse. So I just wanted to kind of give that quick overview. We had been down in kind of the 3% range recently and had started creeping back up, but I'll get to that in just a minute. So that's a quick look at tests. Next slide, please. And this is just the sheer volume of testing being done. I mean, we're talking, at one point, we were doing over 40,000 tests a week for Prince George's County residents during that holiday season last year. The last few weeks, we had been hovering in kind of the 30,000 range. I have a feeling that's probably gone up since then. But you can see, I mean, just the number of tests that have been done for our residents has been astronomical. Been a long couple of years, almost couple of years. Next slide, please. With our cases, our highest week of cases. So keep in mind, we've had over 100,000 cases for Prince George's County residents. Our highest week of cases were 3,700. We had 3,700 new cases the week of January 3rd through the 9th in 2021. So that was that culmination of Halloween, then Thanksgiving, then Christmas, then New Year's, where those infections we saw them just keep building on each other. As folks were getting a little, tired of staying home, tired of not being together with friends and family. What we saw with Delta, we did see that spike back up during this past summer when Delta hit here, but we never got above 1,500 cases per week. So again, all things considered, we really saw that effect that the vaccinations had for us, because we did not see those Delta cases go up anywhere near as high as what we saw earlier this year. Again, we are creeping up now, but more to come on that. Next slide, please. This is a slide I keep a really close eye on. So looking at the patients in the hospitals in Prince George's County. So what does our hospital capacity look like? You hear all sorts of stories on the news about how our hospitals are doing, or how the hospitals in this state are doing or in that state are doing. what you can see is that to date, our highest week was back May 3rd through 9th of 2020. We had an average of 244 inpatients with COVID in our county hospitals per day. Thank heavens, we have not seen numbers anywhere close to that for quite some time. During that winter surge last year, we peaked back up over 200, but you can see throughout much of 2021, even with Delta, we veered above 100, but we didn't veer too far above 100. We are creeping back up though. So that's something that we are keeping a very close eye on. We've seen an increase over the last 3 weeks. That's, again, it's part of that holiday, folks are out and about and seeing each other. So that's not necessarily unexpected, but just to give some perspective about what we've seen over the course of the last couple of years. Not a roller coaster that I've enjoyed being on, and I'm sure you all haven't either. Next slide, please. The good news. So when we look at the reported vaccinations, and for the purpose of this meeting, I pulled these numbers. This is what the CDC publishes for us, for Prince George's County. So this is our residents. It includes the data that's reported from, all of the jurisdictions, from federal institutions, everywhere. This is what the CDC is telling us. And what they've said is that we're actually up to almost 67% of our overall population as fully vaccinated. And we have about 77% who at least have 1 dose. When we're looking, and that's total population. So that even includes the groups that aren't eligible yet for vaccination. So those under 5 years of age. For ages 65 and older, you can see we've been doing quite well with that group, getting up close to 90% vaccinated. For ages fully vaccinated, all the way down to ages 5+ is already over 71% when we look at that population. So thank heavens for vaccinations, because they've made a difference for us in this county. Next slide, please. Oh, so current status, what's going on now? Well, the tricky thing, we were just creeping up at the end of November after Thanksgiving, and our percent of positive tests had gotten up to 3.8%. Unfortunately, the Maryland Department of Health has experienced a cyber attack that means all their systems have been out now for about a week and a half. So we are flying a little blind right now as far as what's going on, but we know where we were heading. We know we were tracking up. So this is not unexpected from after the holiday. We're hopeful that the Maryland Department of Health gets those systems back up and running soon. But for the moment, this is what we know. We know we were up to 3.8%, and we probably continued to head up a bit like we saw in the prior year. Next slide, please. And same thing for cases and our case rate. Everything has kind of ground to a halt while the Maryland Department of Health is addressing their system outage. But you can see our cases, they were around a little bit below 100, a little bit below 100, up, then a little bit above 100. And then that Monday after Thanksgiving, they were at 171. And it was like, oh, okay. So we know where we were trending. We know what we were heading to. Again, not unexpected. This is, it's not uncommon for things to head up after a holiday like Thanksgiving where folks are together. But we do not have any further data at this time. Next slide. Same thing with our case rate. Oh, there we go. Yep, case rate stalled out on 11/29, but we know we were already into that high territory back above 10 as far as our average daily case rate per 100,000 residents. And I won't necessarily go through every single slide, so we can just skip on through. I do want to emphasize where our hospitals are heading. You all saw that hospitalization slide. You can see that our COVID hospitalizations for our county hospitals is trending up as well. So we're keeping an eye on that one. A big part of that trend are those acute care patients, so the ones that are labeled as med-surg. But what happens, of course, is someone is a case, and then they, might become a little more sick. They wind up in the hospital in acute care. And then unfortunately, some folks do progress to going to that ICU. So usually once we see a trend up in the acute care, what follows is a couple of weeks later, we see a trend up in the ICU utilization. Next slide, please. And our hospital capacity has been trending a little lower overall. So this is considering all of our hospital beds, not just beds being used by COVID patients, but other folks as well. So we've got quite a few beds in use and have had quite a few beds in use for a couple of weeks. So again, our COVID incident commanders and Dr. Carter and folks are keeping a close eye on this. And this data is available, by the way, every day, Monday through Friday on our dashboard, publicly available. So if you're interested, you can always go check out and see what the latest information is for these particular statistics. And I think, yeah, the rest is vaccination. So in Maryland alone, we have had over 1.2 million vaccinations provided to our residents. And this is just counting Maryland providers. So not counting folks vaccinated in DC, not counting folks vaccinated by a federal institute, just our Maryland providers have done over 1.2 million for our residents at this point. And that does include over 135,000 of what we call those additional or booster doses. Next slide. So I'm going to run through all of these. There's a lot to share. You can see that really predominantly since about mid-October, the majority of the vaccinations even given have been for those additional and booster doses. So we've continued to see a fairly high uptake with those. And this again is looking at just Maryland providers, but nearly every week for, let's look here, about the past 7 weeks, we've seen over 20,000 vaccinations given to Prince George's County residents. Next slide, please. Age groups. Everybody always wants to know what's happening with the different age groups. You can see we still have some work to do. The 5 to 9-year-olds are at about 15.6%. And those 10 to 19-year-olds are now clocking in at about 60% with at least one vaccination. So we have seen this continue to increase, of course, as folks are getting vaccinated, but there's still some work to be done there. So this is, again, something that we're closely monitoring. Next slide, please. And the other question I get asked frequently, I wanted to make sure and share this one. I'm just looking at vaccinations by race and ethnicity. Right at this time, it's fairly close together there. 72% of Latino residents, 70% of white residents, 69% of Asian residents, and 68% of Black or African-American residents ages 5 and older have received at least one COVID vaccine. The one caveat is the 2020 census data has not been released yet. And so once we have that data, we know the landscape here in Prince George's County is going to shift some. So what I do anticipate is once that data becomes available, these numbers could look somewhat different. We know our population has changed rapidly over the past few years. So I just want to make sure and throw that caveat out because, the data in, data out. So I can only report out on what we have available at this time. And this is based off the 2019 American Community Survey census estimates, but I anticipate there'll be some shifts once that 2020 census data is released. Okay, there were questions. Do you want me to do questions now? Do we have time for questions?
We do have a few minutes for questions. So there were 2 questions that I saw in the chat. And if anyone else has any additional questions, please make sure to put them in the chat for Donna. So the first one was, did the over-the-counter test that you can purchase at drugstores get added to the overall numbers?
Great question. So the numbers that I report out on are not the over-the-counter tests. Those are the PCR test. So those have gone through a laboratory process. So at this time, those are not included in those particular totals.
Okay, great. And then there was another question: are the current hospitalizations mostly from unvaccinated individuals?
Oh, yeah, great question. Here's the problem, because the state data system is down, I can't necessarily figure that out. The data that I am able to report out on for hospitals comes through a survey that the hospitals complete, but it does not break down that information by by age or vaccination status. Of course, that would be a huge amount of data for those hospitals to try to report daily. So I'm grateful that I have what I do have to keep an eye on hospitalizations, but until the state gets that case data back up and running, so I can say, oh, of our cases, you know, X number who were hospitalized were vaccinated. Yeah, I can't really make any judgment about that at this point. And I know that that is going to become even a more critical question with Omicron breathing down our necks. So I'm hopeful again that we can have that data available to us soon. But that is on MDH, Maryland Department of Health. So they're gonna have to do what they've got to do to get it up and running.
Thanks so much, Donna. Really appreciate it. Thank you for sharing all of this data with us and making it in a way that we can understand it. And we'll be looking forward to more data when everything's up and running again.
Me too. Thanks, you all.
Thank you. So now we're going to segue to the 2021 highlights. And what's really special about this is the fact that we can all reflect on what 2021 has meant to us all personally. And we all know what's going on in the news and everything, but it's good to actually look at some great things that have happened in 2021. And so we're going to take this time to look at some of the highlights of what our hardworking work groups have been doing all this year. And so we will be hearing from 3 of our work groups. You can see right here on our slide, our 3 work groups are healthy eating, active living, health equity, and behavioral health. And we have tremendously amazing co-chairs, Jessica Moise and Anthony Nolan for Healthy Eating, Active Living, for Health Equity, Shari Curtis and Phyllis Slade Martin, and for Behavioral Health, Guy Merritt and Kent Alford. And you can see the meeting times here. I'm sure that once you hear about the highlights and the vision, you might be interested in attending some of these meetings. So when you get the slides later on, you can also have that information there. But without any further ado, we're going to start with Healthy Eating, Active Living. And Anthony Nolan will be presenting the 2021 highlights for the HEAL group. Anthony Nolan is our division chief for the Prince George's County Parks and Recreation. And we just like to thank him as he's going to start with the highlights. Thank you, Anthony. Anthony may still be on mute.
How about now?
Perfect.
Good evening, everyone. Anthony Nolan, Division Chief, Special Programs, Department of Parks and Recreation. We have 3 areas that really we want to highlight as part of our report. The first one's on integrated health. We have a new project that we're putting together on health and wellness programming in community-based settings. The goal is to bring a comprehensive health education on healthy eating and active living, as well as mental health practices to places where community members gather. The challenges that, within Prince George's County, chronic disease is a major burden, and people can't always access the programming that may help them in becoming more healthy. The opportunity we have is that there are many nutrition, education, physical activity, and mental health partners in the county, but we don't always offer programming in a collaborative way so that clients can receive comprehensive health education. So we want to bring together the different programs, nutrition education, physical activity, mental health partners, to work in collaboration so clients can receive comprehensive health education. We also have an opportunity to build on the engagement that we have had with community partners who hosted COVID-19 vaccination clinics and the desire to continue to engage in additional healthy programs. The current status is we've completed a draft resource guide working with some students from the University of Maryland, College Park, on offerings in the county by interviewing the wide variety of HEAL partners that we have. The next area is on healthy food priority areas. This has been a really amazing success, the Office of Information Technology worked with the Health Department, Prince George's County Healthcare Action Coalition, and the Prince George's County Food Equity Council to create an interactive health food priority area maps along with a data dashboard. By identifying these areas of the county, we aim to provide an evidence-based approach for allocating resources to encourage the development of healthy food retail. So they worked with the county council. Legislation was passed to formally adopt the HEAL healthy food priority areas maps. Prince George's County has approved personal property tax credits for grocery stores and licensing and permit fee waivers for food trucks who vend in these areas. The health department staff have received training from the CDC on building the map as part of their institutional investment in this area. And then we've worked with the Institute for Public Health Innovation to conduct a photo voice project with youth in the community about the food retail environment in one of these areas in Riverdale. In addition, members continue to meet to outline priorities for future iterations of the map. And I know that we can provide a link to the map so people can take a look at the maps and then the dashboard as well. And then the final area is food as medicine. So this is a new initiative, Prince George's Fresh. It's a pilot fruit and vegetable coupon benefit program, and it's designed to increase access to healthy food in Prince George's County, Maryland. So working with medical professionals at participating clinics, they recommend produce vouchers and nutrition education to patients who are experiencing diet-related chronic illness. Just as a acknowledgement of changing demographics, they have hired a bilingual community health worker to staff the program so that it's available to as wide an audience as possible. The onboarding clinics that were selected and onboarding physician practices to participate. We have completed the coupon testing and successfully tested loading card benefits for Prince George's Fresh benefit. And then we do have participants that are active in the program. And the first successful shopper participated in November 2021 and shopped and received the program benefit, which is a weekly $20 stipend as part of the program. And then just looking in the future, our forecast is to continue to update the healthy food priority area map with new data and new layers for expanded food system, for the food system map. Identify new healthy food retail incentives based on research and public feedback. And then develop a process to crowdsource photos and stories on food retail environments in the healthy food priority areas. And continue to expand the PG Fresh program. And then we're going to work to pilot the integrated health program at one location within Prince George's County. And with that, I'll turn it over to Sherry. Unless anybody has any questions. All right, Sherry, it's all yours.
I think you got a great, thank you for the overview, Anthony. Before we transition to Shari, there is a quick question in the chat for our polls. What are you most excited about with the Healthy Eating Active Living forecast? Because lots of great things were mentioned. Well, Anthony, I think you can see that people are excited about what you've mentioned, so that's good. So everyone, please stay tuned. You'll hear more information about what's going on with the things that have been forecasted as we go into 2022. And now we can officially pass it on to Shari Curtis as she talks to us and shares with us about what has happened with health equity and what's going to be happening in 2022. Thank you, Shari.
Hello, everyone. Happy holidays. I wanted to just share with you a little bit about some of the activities that have occurred in 2020-21 with all the challenges that we all were facing. I'm just so proud and excited about the volunteers that continue to hang in there with us and do the work over that time. In fact, we got pretty good participation because people didn't have to drive on the Beltway to get to the meetings. And so we're really tickled about that. In our Health and All Policies subcommittee, well, let me just start. The Health Equity Work Group, for those of you who don't know, has 3 subcommittees, and they've been very active over this past year and a half. Health and All Policies subcommittee is co-chaired by Shamika Fairbanks and Christine Stewart, and I wanted to give them a little shout out. The Data and Assessment subcommittee is co-chaired by Aria Holland Baldwin and Cecilia Okafor. And the health literacy, which I'll dive into a little deeper, was co-chaired by Dr. Cynthia Bauer, who has recently stepped down from the leadership role, but will continue to be a part of the work group, and also co-chaired by Dr. Suyana Barker. So there's a vacancy in the co-chair slot in health literacy for those of you to take note. So the Health and All Policies HIAP subcommittee developed a fact sheet about HIAP for community folks so that it would be easier for them to understand what Health and All Policy is and what their role is. They had a great opportunity to work with an intern from the University of Maryland and developed a stakeholder engagement plan, which we will share with all the work groups because it's really an opportunity to just look at the elements of how to engage stakeholders in your issues. And we decided to create a health equity champions program so that we could begin to start working with community leadership, understanding health and all policy, how to be a health equity champion, how to recognize inequities and work on improving those situations in their footprint and in the communities they serve. For data and assessment, the work group did research, collaborated with other organizations, and drafted 2 issue briefs that are very impressive. Brief 1 is the impact of COVID-19 in Black communities in Prince George's County. And the other one was the impact of COVID-19 in our immigrant communities in Prince George's County. These documents, the fact sheet and the 2 issue briefs, have now been edited and cleared through the co-chairs of the coalition. And after the new year, they'll be accessible on our website. So we look forward to feedback from all of you on the information that was developed by those 2 work groups. Next slide. So our health literacy work group sort of became a learning community, and during pre-pandemic, the learning community was sharing information about health literacy activities, surveying organizations on how they deal with cultural competency and health literacy, particularly in the provider community. And as we moved into the public health emergency, the health literacy work group collaborated with the ad hoc vaccine work group, for the express purpose to be at the table to make sure that health literacy and the education around vaccines was getting to the right people and appropriate. And so that was a wonderful piece for them. And there's been a little bit of a shift. Next slide. So moving forward for 2022, our health and all policies will continue to move forward with the Health Equity Champions program. Shamika and Christine and members of the team met with Councilmember Glaros, and if you all remember, the RAND report and inspired Councilmember Glaros to do a resolution around health and all policies. And Dr. Askew has presented a plan for implementing some of those aspects of the resolution and the RAND report. And what we'd like to do is continue to support both of those efforts and make sure that the Health Equity Work Group and Health and All Policy Subcommittee is engaged and able to participate in supporting the implementation of some of these plans. And the meeting with Councilmember Glaros was very good. She was very engaged and is looking forward to continuing to work with the Health and All Policies Work Group towards implementation. The Health Equity Champions program will continue to be developed. A curriculum will be developed. The group is meeting on that now and building on all of what we've done from the time we introduced Health and All Policy through our forums, straight on through this process. We just continue to build and grow on these concepts and intend to create some good trouble in Prince George's County as we engage legislatures as well as community leadership on the importance of health and all policy and their role. The data and assessment work group will begin to promote the issue briefs in 2022, perhaps even have some listening sessions to talk about some of the information that's in the briefs and do a dissemination plan. And we're also going to get into trying to learn a little bit more about data visualization. And all of you epidemiologists and numbers crunchers will appreciate this. But what Data and Assessment wants to do is to align with the Health Equity Champions program and begin to share with community leadership and members of the community how to interpret data. And we also want to be able to present data to the community in a way that they can actually see and understand what some of those metrics mean. So it's really exciting what we're getting ready to embark on in 2022. Next slide. And our health literacy learning community is now going to be sort of reformatted back into a subcommittee as a result of a health literacy grant, that a multi-year grant that's been acquired by the health department. The health literacy subcommittee will be a part of that planning process and continue to work with the county on the health literacy activities that will emerge from that funding opportunity. As I mentioned before, Dr. Suyana Barker is currently the co-chair of that subcommittee, and we are looking to add more people and also get some partnership leadership for Suyana to co-chair that health literacy subcommittee. So as we retool it, we look to you all to let us know whether or not that's something you might be able to get excited about. I'm done. Thank you, everyone.
Thank you so much, Shari.
I just wanted to give one more shout out because it's really important, because Dr. Calandra Whitted has just been wonderful this year in helping us stay on task. We've got a lot going on with the volunteers of this work group, and we really appreciate the support that she gives all of us. So I just wanted to give a quick holiday shout out to Calandra for being such a good champion of our work group.
That's wonderful. Thank you, Calandra. Yes, Calandra is excellent. Well, once again, we're asking everybody, what are they excited about when it comes to health equity? So please go ahead and put your vote into the poll.
And it's a good opportunity for me to remind people that we're always recruiting, and all of our subcommittees would really love to have more people join them in their efforts.
And you said it with a smile.
Because I mean it. It's a lot of work, but everybody's just been so wonderful. And, you know, no one has really time to do this volunteer work considering what everybody's faced with this year. So we are absolutely impressed and thrilled.
Indeed, indeed. Thank you, Shari. Well, I think our poll is coming to an end. So right about now, we are going to segue to the Behavioral Health Advisory Group, also known as Pghac, and Megan Sontag will share with us some of the highlights from 2021 and also some of the forecast for 2022. Thank you, Megan.
Thank you. Yes, so I will talk about the Behavioral Health Advisory Group. The sequential intercept model details how individuals with mental health and substance use disorders come into contact with and move through the criminal justice system. So there was a workshop using this model from the Samhsa Gaines Center. We won a grant in the spring of this year. And it brought together leaders in different agencies and systems to work together to identify strategies to divert people with mental and substance use disorders away from the justice system. The workshop, like I said, was completed in the spring, and the draft report is being reviewed and edited by all attendees, and we'll have that report finalized in January. The Network and Workforce Development Subcommittee was renamed this year to better reflect the work of the subcommittee. So the new name is called the Behavioral Health Integration Group. We welcome 2 new co-chairs for this subcommittee, Dr. Neverson, who's the Vice President of Maryland Programs with VOA, and Scott Showalter, who is the Coordinator of Psychological Services with PGCPS. This subcommittee endorsed an integration framework for providers to use to determine where they currently are in terms of providing integrated care and develop goals to further their work on the integration continuum. Along those lines, we had a host of one learning session. Bree Riemann from the National Council for Mental Wellbeing explained the history of integrated care and the history of that framework the committee endorsed. And the session is available to view on our website currently. Sorry about that. We also have VOA Health Department and PGCPS collaborated to provide mental health outreach to school-based COVID-19 vaccination clinics. So that was a great exercise in integration that was very successful. And lastly, this work group also launched, which you'll see on your screen, the Behavioral Health Advisory Group Partner Directory. And the goal of this directory is to allow for better collaboration on funding opportunities and help with integrative care. The partner directory will be maintained regularly and accessible by all Pghac members, and it's currently being completed. That's just an example picture of what it looks like. And our last subcommittee is called Assessment Education. And this work group has a focus on reentry. So after a year of collaboration with the Reentry Advisory Board, this subcommittee relaunched in November. And is to help support the implementation of the Reentry Advisory Board recommendations. During the collaboration with the Reentry Advisory Board, the subcommittee contributed to surveying community-based providers who assist returning citizens. The survey has over 30 providers on that who participated. They researched findings, discussed gaps, and identified evidence-based practices associated with reentry. And if you're interested in any of these work groups, my contact information is below on the slide, so please contact me and we will get you involved. And lastly, the forecast for the future for Pghac. So for the sequential intercept model, as I said, the draft report is being reviewed right now and edited, and will be finalized in January, and we'll begin implementation early next year of some of the priority areas determined by that report. The Behavioral Advisory Group directory will be completed by all partners and shared to promote that collaboration amongst partners. We are also hoping to host additional learning sessions to promote the integration of behavioral health and somatic care in Prince George's County. We currently have draft plans for a session in late January, so we'll be seeing communications regarding that session. And we're also developing a Prince George's County reentry toolkit for community-based service providers. And that's the Assessment Education Subcommittee working on that. And we're going to provide training on evidence-based practices in reentry among community-based providers that support reentry. And that concludes Pghac. We can take any questions.
All right, well, thank you, Megan. You went through a lot of stuff very quickly and very efficiently. We have our wonderful poll again, lots of things that you can be excited about. So please go ahead and jump on the poll and let us know what you are really excited about in terms of Pghac for 2022. While you're doing this, if you have any questions, anything that has been percolating now that you've heard about HEAL and Pghac, and also about health equity, if you have any questions for our facilitators, please feel free to ask them in the chat. What I can say to everyone that has shared their summaries is that there are lots of people saying that you've done a great job and that they are excited, as we can see in the polls. So while the poll is going on, and then I know that it will close in just a few seconds, I do want us to have just a few more things to be excited about as we go into the holiday season. And so I would like for us to get ready to hear more about the vision for 2022 from our very own Dr. Carter, as he speaks about what the vision will be for the coalition on a whole here in Prince George's County. So Dr. Carter, we are with listening ears eagerly anticipating what you have to share.
Thank you so much. I am going to try to share, unfortunately, my slides are, my one slide, I only have one slide, did not get into the mix. So what I'm going to do is to try to share my, my slide with you. So if you could give me just 1 second. And
absolutely.
Let's see. I'm going to share my.
I was going to say, while Dr. Carter is doing that, I just want to recognize Ray Wallace, who does an amazing job on all of these slides for us through our meetings and also our website and our newsletters. So while we're doing a shout out to our research assistant, I want to make sure she's recognized as well.
Thank you, Donna. And Megan, or whoever's controlling, can you allow me to share my screen? Thank you. Let's see. Okay, can you see my screen?
Yes, we can, Dr. Carter.
Okay, this is for 2022. Now, one thing I need to say and be very clear is that I am absolutely amazed at our coalition. Yeah, I was around at the inception of the coalition when it first started. It was a rocky road. There was a lot of great work being done. It was small, it was energetic, but it has now become a real solid force in the community. And the work that you all are doing is absolutely pinpoint, it's evidence-based, and it's moving our community forward. I mean, and I know you all know this. I mean, in ways that I am just thrilled about. I couldn't have imagined when it first started that it would be where it is now. It's as far as I'm concerned, it's the best in the state. It is the best LHIC in the state. And it's going to get even better, because what we're going to do in 2022 is to start consolidating our efforts. So I'm going to really give everybody heartburn, because I'm going to introduce a new function into the Prince George's County Health Action Coalition. And that function is that it's going to play a significant role in doing population health management, not only for our county, but it's going to be significantly aligned with what the state has to offer in terms of where they're going with their SIHIS model, their state healthcare integrated healthcare system. So I'm going to introduce, this is what we have to look forward to in 2022. It doesn't take away from what you're doing now, but it's going to augment what you do, because it's going to have us thinking about our efforts in a consolidated way. So to tell you what I see as the future of what we're doing here is that this particular body is going to be the main driving force in how population health management actually occurs in our county. It's going to, number one, and it already is doing this by identifying the needs in the community. And that clearly is through our channel, and that we do that as the health department, and it's accented by this particular body. So that's along the lines of what we already do. But the next step is going to be something that's going to be new to you all, and that's going to be doing risk stratification. And of course, the health department is going to be the lead on this, but you all are going to be an integral part in when we get the data and we stratify the risk, then the next thing to do is to figure out what interventions go with what risk category. So if we stratify a population, we know that this population has certain people who are low risk, certain people who are moderate risk, and then certain people are high risk or even higher risk. And how you stratify that and then link that stratification to the particular interventions that are being done in this county is what is the linchpin in how to do population health management. So if you've got efforts, if you have interventions that clearly can help people who are in buoy, who are high income, but you see people trying to apply that to folks, populations who are not in that particular population, it's the job of this particular body to be able to say, this intervention, that's an extreme, but I'm just saying this body's function in population health management to say this particular intervention is a mismatch. This doesn't work here. And so to be able to do that, you all have to basically review interventions that are being done in Prince George's County. I don't care who's doing it, whether it's a hospital system, whether it's a 501c3, whether it's the health department. But if it's being done for our residents and around health, it should be matched to the population that it's should be matched to. Now, how do you know it's matched? Well, first of all, does it match to the risk category? Second of all, is it culturally appropriate? Third of all, has anybody taken into any consideration the environment? And one thing that's not there is that, which I included sort of in the environmental category, but I really shouldn't have, is that has anybody considered the behavioral health implications in those interventions? I mean, a lot of times interventions are done without taking into consideration any of those things. So this particular body will do that. They'll take a real look at what are these interventions really matched to the right risk categories, and does it match the people and the environment and the behavioral health of that environment? The other job that you all will have is to keep an inventory and to catalog the interventions that are in the county. You know, I bet you right now, I know I can't name all the interventions in the county and where and what category they're with respect to. But we have to do that. We have to have that in this county because you need to know what interventions there are, because that leads to knowing what resources that are available to people. Some interventions are just demonstration projects. Other ones are projects that go on to help with the infrastructure. We as a body need to be able to be the source of that. Now, of course, this is with the health department support. I'm not saying I want you all to go out there and do this, but this is how the LHIC is going to function in population health management. It's going to be the source of overseeing the inventory of the interventions that are in this county. But not only that, they're also going to oversee how coordination is being done, care coordination is being done in this county, and are people actually connected to resources? Because if there are mismatches, I can tell you among a lot of interventions, people do interventions because they have to fulfill a requirement. Like if the CMS tells hospital systems, you have to have a community, in order for you to get us to pay you, you have to take community benefits dollars and do X in the community. Well, it's going to be this body that says, well, you just can't do anything. You're going to have to do something that aligns with the population health, how we're managing our populations in whatever target population you're talking about. That's this body. It's sort of the watchdog of population health. It's going to monitor whether people are progressing toward their goals. And then it's going to summarize, this body is going to summarize what you found. And it's going to pass that on to another body, our community of practice, or to the health department, or to an advisory committee that says, you all now, this is what we found, and now you all need to take it from here to make sure that these interventions are changed. So you're not the enforcement arm, but you are the arm that actually is looking over community-based projects in particular to make sure it's serving our people. So when people talk about population health management, well, the people who should do population health management is public health, And it should be driven by an organization that's based from the community, because that's the only way they'll really be effective. And it will be my job to be sure that you have the resources you need to do it. But what I need for you all to do is to understand that in 2022, this is the vision for what I have, that I have and the health department has for the Health Action Coalition. And then lastly, you all have to keep the community informed. We'll get data, and just like what you're doing right now, you all are doing that to a high degree. So when we start doing this as part of population health management, you all are going to be the source of information to the community. One of the sources, but a primary source, because you're going to be in an oversight position. So I know that's a lot, but we won't be able to progress in this community unless we do a lot. And we got an incredible amount of talent right here. I mean, it's an amazing amount of talent that you all have. I'm just proud to be a health officer so that I can, call upon you to help us change this community. My goal, 5-year goal, hopefully we can do it in 5, maybe 7, I don't know, but we're gonna have a 5-year goal, is to, at the end of the day, move the needle on these health outcomes in our community and have a system that can move the needle, because it's going to be we'll be able to manage the healthcare of our population. So that's what I'm looking. So baby steps, first step next year is to actually see how we're going to affect this. How are we going to get this function to occur in our Health Action Coalition? And so in the first 3 months of the year, I'm going to be talking to you a lot about what does this actually mean? Go through some use cases, go through some scenarios. We'll act it out. I know I've got enough people who know how to do that. I'm not good at, doing like what you all do when you all go through use cases, but I have the people who can do it. And we're going to go through use cases and sort of mock events. So give you an intervention and say, or give you a population and say, how are we going to stratify this? How are we going to link it to interventions? What do these interventions fit? So in the first 3 months, we're going to test the waters and figure out how this will best work. And then going forward after that, we're going to go live. It may take more longer than 3 months. I don't think so. So anyway, that's what we have to look forward to. I am very excited about it because I know this is the right thing to do. I know and you all are the right people to do it. So I am extremely excited about this, and there'll be more to come in 2022. So thank you all again. I really appreciate all the effort you're doing. I am going to put my heart and soul into making sure that our population health efforts in this county actually work, and that I support you guys in every way I can. So thanks again.
Thank you, Dr. Carter. Thank you for the vision that you have set for all of us. In the chat, it was mentioned by Gregory Taylor that he applauds your approach to addressing the 4 pillars of health. And I'm sure that that is a sentiment that's echoed with many of the individuals on this call tonight. You have cast a very large vision for us, but if you don't cast a large vision, then it's not challenging, it's not as rewarding. So thank you for this. And we will hold you to guiding us through all of this in 2022. If anyone has, there's something else from Gregory. Sorry, Gregory. We need to get the environmental entities involved as well. Dr. Carter, got that?
Absolutely. Yes, I do. Thank you. Absolutely.
Absolutely. Right now, we are at the ending of our presentations and our program. However, what we would like to ask, seeing we're in this space, is if anyone has any announcements that they'd like to share. We will look out for raised hands if anyone has any announcements. All right. Okay. Oh, Dr. Carter, there's also another mention in the chat. It says, thank you, Dr. Carter, for your leadership and for your vision. We appreciate you and all that you and the health department is doing to improve the health of Prince Georgians.
Thank you.
Okay. Gregory, you raised your hand.
Yes, good afternoon, Dr. Carter and team there. I congratulate you on doing an excellent job. And I just want to emphasize a comment on the environmental entity and getting those involved. And the reason I say that, the public works or environmental entity, because a lot of our communities you are aware of have environments that need cleaning up. If it's trash collection, debris, businesses that haven't mental standards of safety and health issues, and all that affects health. So I would highly recommend we have some entity from that group involved in these committees, especially as you talk about going forward and addressing it from more of a consolidated approach to addressing health and the issues that affect our community.
Thank you, Gregory. You know, the interesting thing about Prince George's County is that, and when I came, I noticed it, and I'm making a dedicated effort to move in this direction. Prince George's County is right in the smack dab in the middle of a place where climate change can significantly affect us. You may or may not know that, but it is. It's right there, and we have to start to beef up our awareness. Even in every intervention we do, we need to be aware of how the climate can affect what we're doing. It's not only it's not just food, and it's not just water. It's air. It's radiation, it's all sorts of effects as toxins in the environment, et cetera. And for us to make sure we're moving the needle, we have to be sure that we're acutely aware of that. And of course, there are all sorts of environmental interventions that we need to be keenly aware of, especially with people who have conditions that their environment affects them. And so all the medicine in the world can't cure an asthmatic who is in a house full of roach dander and other allergens that trigger their asthma. It just makes them worse. We have to understand how to make sure that when we're looking at what we look at, we take the environment of our target populations into account. So we will, from whether we're talking that or from radon to air quality, from factories or whatever it is we have to do, we're going to take all those things into effect, because this body is the body that will help push policy. And because of that, we're going to make sure that when we do health in our policy, we're talking about every aspect of health: clinical, behavioral, social determinants, and environment. And we're not going to leave the environment out. We're going to be sure that we include that. And I know that once we have that sort of mindset, we'll start pushing our legislators to be more acutely aware of some of the policies they need to do and some of the funding that needs to go into that, to making sure that policy is effective.
Well, thank you, Gregory, for bringing that up, and thank you, Dr. Carter, for your response. So we are officially, unless actually I saw Shari unmute. Shari?
Yeah, I just wanted to share with Mr. Taylor that there are members from the environmental justice community that participate in the health equity work group, and that I've had an opportunity to be on a panel with Dr. Wilson, Zacoby Wilson, who's doing a lot around health impacts from the EJ perspective. So if you have an opportunity to hang out with the health equity work group, we may be able to get you involved with that component. Just a shameless plug.
We take all shameless plugs. That is fine, Sherry. And then let me just read this one last comment in the chat. Dr. Carter, I must applaud your efforts that facilitated the marriage of health and mental health. That was from Cheryl Maxwell, and wishing happy holidays. So I will take that happy holidays ending for that announcement, and also wish each and every one of you on this call a happy holidays on behalf of the entire coalition and the leadership, and from our co-chairs, Dr. Carter and Dr. Little. Thank you so much for joining us this evening. Our next large quarterly meeting will be held on March the 8th, 2022, which will be here before we know it. Our select work groups and subcommittees will be meeting between now and February. So definitely, if you are interested, please reach out to us. You will receive the slides with all of the contact information on it. And please feel free to reach out to us between now and March. And we hope to work with you in 2022 to make Prince George's County the best county, as Dr. Carter said, in the state of Maryland. We wish you a happy holiday. All the best.
Happy holidays, everyone. And Megan, thank you so much for your assistance. I really appreciate it.